Good afternoon. I'm Steve Farkas, Assistant Dean for the College of Business, and we'd like to thank you all for joining us for our third COVID Business Information Session. We are pleased to have our globally recognized economists from the College of Business sharing insights into their research on the national economic impacts of the current pandemic. We hope these insights will assist our businesses as they prepare for a new economy and a new way of doing business. If you happen to have a question, please submit your questions using the Zoom chat feature during the presentation. In the event we have time left in the hour, we will attempt to answer. If not, your questions with answers from our experts will be updated on our COVID information website. It's the website where you registered for today's event. With that, I'd like to turn it over now to Linda, who is an assistant professor of economics here in the College of Business.
Thank you so much, Steve. And yeah, we can proceed through the slides here. Great, so this is our group, and that's me. Our group here has, we quickly sort of shifted gear from the other types of research that we have been doing so far when we enter this crisis, and have focused very much of our efforts lately on COVID-19 related issues, mainly consumer behavior and policy responses. So what we're going to do today is we're going to give you first an overview of the national economic situation, and then Maddie is going to continue with the economic situation in Wyoming, and after that Jay and Steve and Dave are going to get more into the weeds of the policies that we could imagine in Wyoming and the effect that those will have on the epidemic and the economy as well. And there we will talk more about our own research, whereas here in the beginning then we will rely more on other people's research and publicly available data as well. So we could move on, Kat. Thank you. So what can we expect here? Well, we're entering a recession for sure. We know that, and I think we need to go back. Thank you. During recessions, there are a few things that we typically see. So consumption of especially durables are going to go down. And what are durable goods? Where durable goods are cars, furniture, appliances, and so on. So any type of good that you wouldn't sort of consume on a daily basis, or that you don't have to switch out on a daily basis. Those are the types of goods that we typically cut out first. Non-durable goods have typically stayed relatively stable because those are more of the essential consumption that we conduct. So that will be food consumption and fuel, cigarettes, alcohol, and so on. And then services, that is a large part of consumer consumption as well. And that will be healthcare, financial services, education, restaurant visits, and so on. And they have typically been fairly stable during recessions, but we will see that that was not the case during the latest recession that we experienced. And why is it important to focus on consumption here then? Well, consumption drives the US economy. We have a big domestic demand, and 70% of US GDP, which is typically the wealth measure that we use of a nation, is driven by household consumption. So we should expect to see the typical patterns that we see during recession, but we should also expect to see additional features here that come from the uncertainty with transactions. Next, please. So for a comparison here, I included the Great Recession, as we call it. That will be the recession that we experienced during 2007 to 2009. And this is consumption of durable and non-durable goods during that recession and what we can observe in the data now. So that will be furthest to the right. And as you can see, we've already had drops that are, similar to what we experienced when the Great Recession was at its worst. Non-durable consumption is up compared to what it was before, and that is primarily because people have been hoarding and also substituted some of service consumption, for non-durable consumption at home at this point. Okay, next please. And this is our service consumption that, again, during the first quarter now, so this is the official data that we have on a national level. We can see that that has already dropped to the same extent as it dropped during the Great Recession as well. And this is just, again, the first quarter, which probably reflects mostly of the drop in March. So we should expect a greater drop in the second quarter or from April and May here as well. Services make up 70% of household consumption, so this is definitely going to take a toll on our overall consumption levels. Okay, next please. And part of why this is happening is the lockdowns. Part of why this is happening is people's fear, and part is what we can observe here, and that is that people have lost their jobs, so we lose income, and that of course means that we we consume less. And the latest unemployment numbers here for the US as a whole was 14.7%, which is the highest unemployment that we have experienced since we started measuring unemployment in the nation. So this time series goes back to 1948. We saw that we topped out at 10% during the Great Recession, and we've already higher than that, and most experts think that we're going to experience even higher unemployment before we turn around here. Okay, next please. And here then we have forecasts of where the national economy is heading this year. This is from the Conference Board, but most experts seem to agree on that we're assuming a GDP drop for the nation as a whole that will be around 6.5 to 7.5%. For comparison there, during the worst year of the most recent recession, we saw a drop in GDP of 2.5%. So we're in for a rough ride, and most of these scenarios though still assume that we're not going to see a second wave of the virus. The red line here that dips down represents that, and that then means that we will also see bigger drops in GDP growth. But the other scenarios typically assume that we start coming back to something that is semi-normal towards the second half of this year. So that's perhaps fairly optimistic. Okay, next please. So with that, I'm going to leave the word to Maddie, who's going to tell you more about the situation in Wyoming.
Perfect, thank you, Linda. So today I'll be kind of talking about consumer spending in Wyoming and the different industries in which we see that spending, and how the spending we see in Wyoming is related to the number of confirmed COVID-19 cases and county restrictions. So if we could go to the next slide, please. So the data I'll be talking about was compiled by Chetty et al., and it is an aggregate consumer spending data. And they got this data by tracking credit and debit transactions per day at the county level. And so this national spending data can actually be broken up by states and individual counties. And they also break up the spending data into categories like transportation, healthcare, groceries, entertainment and recreation, and general merchandise. So in this graph we have on this slide, we see that total consumer spending has dropped nationally and for Wyoming, Montana, and Colorado. As of May 1st, we see that total national spending has dropped by about 21%. Comparatively, Wyoming's total spending has dropped by about half of that, by only about 10%. So consumer spending in Colorado has dropped more than the national average with a drop of about 26%. So from this graph, we can also see that spending began to decline sharply around March 15th, prior to most of the stay-at-home orders. So consumer spending also began to rise after the stimulus payment started, but the consumer spending has not completely recovered. So next slide, please. So I'll now look at spending in Wyoming in different industries that are important to Wyoming and our economy. So first, looking at transportation spending. So transportation spending involves anything regarding the transportation of goods and people. So more generally, it's spending on things like gas while traveling, bus fees, and goods hauling costs. So as of May 1st, total spending on transportation dropped by nearly 60%, about 10% less than the national drop in transportation spending. So this drop in spending is likely related to the stop in travel due to stay-at-home orders and just the stop in commuting to work. So again, we see that this decline in spending began prior to stay-at-home orders. And interestingly, the stimulus payment did not actually boost transportation spending, and total spending has seemed to even out in the last month at a 60% reduction. So next slide, please. So now we can look at healthcare spending in Wyoming. And healthcare spending encompasses all spending on any health-related activity, such as medication, surgeries, and any medical treatments. So we see that healthcare spending has dropped by almost 40% in Wyoming and by almost 50% nationwide. So once again, we see that this decline began prior to the official stay-at-home orders. And after the stimulus payments, we see a sharp increase in healthcare spending that has then dropped back to levels prior to the stimulus payment. So this could be due to things like stockpiling of medicine, like cold medicine, over-the-counter medicines, or an increase in those who are asymptomatic getting the tests, or those who may believe that they have COVID who are now going to see the doctor. And the reason we stress that it's asymptomatic people who are getting tests rather than symptomatic people is that when in Wyoming you can get, if you have symptoms of COVID-19, you can actually get a test for free, but if you're asymptomatic, you have to pay for that test. So next slide, please. So now we'll look directly at grocery spending in Wyoming. And this is the only sector of spending in the data set that has increases in spending. So this is spending for food and other common items you'd see in the grocery store, like paper products, alcohol, and tobacco. So spending on grocery items peaked prior to the stay-at-home orders as most people began to stockpile food and other products. And at the peak, grocery spending in Wyoming was up by about 55%. Currently, grocery spending is about 12% higher than prior spending before COVID-19, and while the national average is about 20% higher. The stimulus payments did not lead to a clear increase in grocery spending, but there does seem to be a peak in spending at the end of April. So next slide, please. So now we'll look directly at entertainment spending, which consists of all things directly related to arts, entertainment, and recreation. So this spending could include things like spending at movie theaters or national park entry fees. So entertainment was one of the hardest hit sectors, along with transportation and restaurant spending. And as of May 1st, entertainment spending was down 60% in Wyoming, while the national average is down 70%. So the stimulus payments did not have an obvious effect on entertainment spending, as most venues in which entertainment spending could happen are closed due to the stay-at-home order. Next slide, please. So the last industry we'll look at is restaurant and hotel spending in Wyoming. So this is any spending directly related to dining out and the restaurant industry, as well as any kind of lodging industry. So in Wyoming, again, as of May 1st, we see that spending in the restaurant and hotel industry was down about 50%, and the national average was down about 60%. So like we have seen in all the other sectors, except the grocery sector, this decline in spending began prior to the official stay-at-home orders. So restaurant spending did not drop completely, as most restaurants continue to do takeout. And after the stimulus payments, we see that restaurant spending did actually increase. However, it has decreased since the end of April. So next slide, please. So now we'll look at how consumer spending compares with the number of confirmed cases in Wyoming. So this map on the left shows the most recent confirmed case count in Wyoming, which has exceeded over 500 confirmed cases. The hardest hit counties are Fremont County, Laramie County, and Teton County. So there's also a map on the right that shows the percent change on all consumer spending, where the darker red the county is, the more reduction in overall spending. So when comparing these maps, you can actually see that lower consumer spending does not perfectly correlate with the number of cases. So to see an example of this, we can look at Teton County. And Teton County had a 36.9% reduction in spending. It was the county that has the most reductions in consumer spending, but it doesn't have the highest case number in the state. Fremont County is actually the county with the most confirmed cases, but has only actually seen a 9.4% reduction in spending. So from the comparison of these two maps, it's likely that the reduction in spending is actually related more closely to the industries that support the county rather than the number of cases in general. So Teton County, for example, relies almost exclusively on tourism as their main source of income, and the related industries like restaurants, hotels, entertainment, transportation have all been hit hardest due to COVID-19. Or on the other hand, a county like Fremont County doesn't rely directly on tourism. In fact, the largest employer in that county is actually the government, so that kind of sector is probably the least likely affected by the pandemic. So next slide, please. So this slide shows a consumer spending map, the same one as we had on the last slide on the left, and a map of all the county variances of the state restrictions on the right. So on May 8th, the governor of Wyoming actually issued a new stay-at-home order that opened up some businesses like hair salons and gyms, but the restaurants had to remain closed. And from the variances map, we see that most counties have instituted variances that lessen the restrictions given to the state. So you see that counties that are in the green here, they opened up for dining and gathering variances. So they allow some dining establishments to open, and they also allow larger gatherings than the state restrictions had. And then you can see those counties in gray, the Fremont, Laramie, and Bighorn County are all continuing with current state regulations. And the only county that has actually placed more restrictions on their businesses than the state order had is Teton County. So we can kind of guess, even though some states are beginning to open up, that it's unlikely to lead to an immediate or quick recovery, because as we saw in the previous slides, consumer spending began to drop significantly before the stay-at-home order was issued. It's likely that concerns over personal safety were actually the largest drivers of the reduction in spending, not the stay-at-home orders themselves. So with that, I will hand it back to Linda.
Thank you. And this is an example of a state that has opened up again. So Georgia, and we see similar developments in the other states that have also opened up. And as Maddie was describing previously, we here too see drops for Georgia in consumer spending that started before the stay-at-home orders. We see an increase here in consumer spending from the stimulus payments that were done in April 13. But then when the stay-at-home order ends, we don't see that increase continuing. Now, that said, this is just a week of data. This might change, but it's not like people went out and immediately started shopping once the stay-at-home order ended. And of course, there are several reasons for this. First, people are nervous. It's the pandemic in itself that reduces much of consumer spending. And also, we now have an unemployment rate of 14.7%. We have stimulus checks, but people are going to be uncertain about their future income. So that is also going to hamper consumer spending here. So, even if we lift these orders, we're not going to go back to normalcy very soon here. Okay, next, please. So what could get consumption and consumer spending up again? Well, the typical two factors here that pertain to any recession is, we got to make sure that people have money. They got to have their jobs. So the unemployment here is, of course, worrying. Also, if we're going to be uncertain about what happens in the future, we're not going to spend as much. So that is also typical for any recession. And then we have the factors that relate to COVID-19 beyond the typical factors for recessions. And that is if people simply are getting, they're nervous, they want to stay home, but at the same time, this is hard. And we're getting fatigued from social distancing, and we're going to say, you know what, I just want to get on with my life. So that means, that people might downplay those risks of the virus as this goes on. Now, that might go for some people, and other people might be more risk averse. So when some groups get fatigued and start mixing more in society, others might social distance even more because now the risks have increased, and we don't know the net effect of that. But transactions need to be safe. So when we do our consumption, we need to know that is safe. And then finally, we need to enjoy those safe transactions. So at the bottom here, we have an image of a waitress with a face mask on. And, it might be that those experiences, the safe experiences, aren't really the same. Either we get used to them or we don't, but we need to enjoy those to consume as well. Okay, next, please. And finally, this is, we've painted a pretty gloomy picture, but this pandemic as well presents some pretty unique opportunities for Wyoming compared to most other states. So let's say a few words about that as well. And first, even though there is no hard data on that yet, and it depends on how defining this pandemic is going to be to people's lives, but living preferences might change. People who live in houses are better off right now. People with better access to nature and land are better off in this situation. And we might learn to appreciate those features more, which of course we have a lot in Wyoming. We might learn to appreciate a slower pace of life. And also we're all sort of getting a crash course, both firms and people here, in working remotely. So that could be something that could cut costs for firms and cut commutes for people. We might appreciate that. And when we work remotely, we can get all the other features here as well as live in Wyoming. Lastly, Wyoming has been relatively unaffected by the virus. And partly, it might be a small part, we don't know yet, could be due to the specific conditions also when it comes to air pollution and wind in Wyoming. But if we come out of this as a relatively safe state when it comes to the pandemic, that could also benefit Wyoming. And so far, that seems to have been the case. Thank you so much. Now I'm turning over here to Steve.
Hi, thanks, Linda. Yep, that's me. You can switch to the next slide already, Kat. All right, so, and again, yeah. So one line of our work on COVID-19 involves basically combining basic epidemiological models with basic economics to help understand how we might best respond to the outbreak. So before I get into this, it's important to understand sort of the role of this type of modeling. There's too much uncertainty about the virus and how people will respond to make precise predictions months or even weeks in advance. But what we can do with these models is make educated guesses about the effects of the virus, use the models to basically systematically explore the logical implications of those assumptions. Some of those are going to be supported by a lot of solid data that pertain directly to the case at hand. Others are based on extrapolations from more or less similar scenarios we've observed in the past. So all of this is just to say at the outset that what I'm going to show you in the following slides is an example of this kind of modeling, which is intended to provide policy insights and to support sort of comparative policy assessments, not provide precise predictions or definitive policy guidance. Okay, next slide. So sort of the workhorse epidemiological model that's used to help understand the spread of infectious diseases like COVID-19 is the SIR model, which stands for the 3 categories of people that are tracked in the model. Susceptible individuals have not yet contracted the disease. Infected individuals have been infected by the virus and they can spread it to others, and recovered individuals had the disease and they've recovered from it without dying first. And the way these models work is basically to project the expected number of people in each of these compartments tomorrow based on the number in each compartment today, plus assumptions about how the compartments interact. And the standard assumption, and one I'm going to use in my examples today, is that susceptible and infected individuals mix randomly on any given day. So the number of people who will become infected tomorrow is proportional to the product of the number of susceptible and infected individuals today. So that's what's represented by the arrow connecting the S and I boxes in this flow diagram. The 1 minus x squared term represents the influence of social distancing in this model. So x is basically the fractional reduction in the average number of encounters each individual has with other people. Gamma multiplies the I on the arrow connecting the I and R boxes. That's the rate of recovery from the infection, and the quantity below the I box is representing the probability that infected individuals will die before recovering. So this model is one we've relied on heavily in our research on the benefits and costs of social distancing so far. Next slide. But another strategy for controlling the virus, and one that might be more relevant now that we're beginning to relax social distancing measures throughout the country and in Wyoming, is a strategy of testing and self-quarantine. So this is another approach that people have talked about. So in this model, there's no social distancing, but instead there's a testing of susceptible individuals or anyone who hasn't been known to have recovered from the infection is tested at a certain frequency. And so each day, a fraction of infected individuals are identified by testing so they can remove themselves from the mixing population by self-quarantine, and so will not spread the virus to others. So of course, if we don't test everyone every day, then some new infections are going to get missed. So we don't expect to catch every new case. But what we can do with a model like this is basically infer the testing frequency that's required to flatten the curve by a certain amount. And we can compare that to what happens in the social distancing model I showed a moment ago. Next slide, please. So with those sort of 2 models set up, we can make assumptions about the key parameters and then compare the outcomes. So the assumptions I've used in the examples I'm going to show you in a minute are on this slide. And I won't talk about these in detail, just to say that these are meant to be middle of the road values. They're consistent with our previous benefit cost analysis study at the national level. The next couple slides I'm going to show you are sort of scaled to the population size and the GDP of Wyoming. So these are meant to be instructive for our state, at least at a very high level. Next slide. So this slide shows a projected number of infected individuals over time under an uncontrolled scenario and under 3 different social distancing policies, each more stringent than the previous one. And in each case on this slide and the following one, I've assumed that the policy is held in place basically until herd immunity is reached, or for 1 full year, which is when I'm optimistically assuming a vaccine will arrive in this example. So the implication here, if you can read the numbers attached to each of those curves, is that at social distancing fraction of 21% for 125 days is the best we can do with a social distancing policy in this case. That's the case that has the highest net benefits of $3 billion here. And that net benefits is basically the difference between the value of the lives saved by flattening that curve, that amount, and the amount of income we lose in the interim while we're doing all this social distancing to achieve the flattening of that curve. And so the other curves are showing that, you know, a lower level of social distancing achieves lower net benefits, and a higher level also achieves lower net benefits. So, you know, this is a scenario where the cure too aggressively applied would be worse than the disease. In fact, that last one has negative net benefits. Okay, next slide is my last one. So this final slide shows that we can get the same kind of curve flattening effect by basically continually testing a fraction of the population, so people who learn they're infected can isolate themselves for the duration of their infection. And here you should notice that the net benefits are much larger, and they peak at a much flatter curve. So here the net benefits are maximized at a rate of testing of 24%. So in this scenario, everyone would be tested about every 4 days, almost twice a week. So that's a massive testing program. But its cost, I'm assuming $50 a test in this case, which is sort of somewhat higher than the aspirational costs that have been talked about, would be far lower than the lost income from a prolonged social distancing policy, and it would prevent more deaths than such a policy, again, under the assumptions of the model. So, of course, the success of either of these strategies in the real world depends on how faithfully they can be implemented in reality. Will people maintain effective social distancing for the duration of time required to flatten the curve without the risk of a second wave? Linda mentioned that. Under the testing case, would enough people get tested at the required frequency for a testing approach to be as successful as indicated here? Our final presenter, Dave Finoff, will talk about some preliminary evidence we have about likely testing compliance based on a recent survey that we conducted. But first, before Dave is up, I hand it over to Jay Sjogren. Thank you.
Thanks, Steve. Hi, everyone. Jay Sjogren here. I probably met most of you, even if I can't see you, so. Next slide, please, Kat. So if the equations and arrows and graphs scared you in Steve's presentation, here's something that you can do yourself. The RAND Corporation, one of our former colleagues, Aaron Strong, is part of this team. He was here at Wyoming for a while and left. They've developed a tool where you yourself can go play around with different scenarios, different lockdown times, different releasing the economy's times, and you can do it yourself, and you can experiment, and you can look at what it means in terms of essentially the model similar to what Steve was presenting, but all the equations and all the different assumptions are behind the scenes. It's much more of a user-friendly example. We don't have that for ourselves right now, but we don't. We weren't geared for that. The RAND Corporation has done it for every state. So if we're here in Wyoming and you're down here in the southeast corner and you're interested in what Colorado is going to do and how they're going to react, you can play with Colorado. You can go do Montana or Utah. So all those surrounding states, especially for folks who are interested in tourism and people coming across, what their likely scenarios are. Next, please. So what this tool does, it gives you a review of the public health and the economic data by state, and it models, similar to what Steve was showing you, both the social and these economic effects of the different levels of interventions. And then it can evaluate sort of the best practices, and it can compare against other considerations too. So you can get an idea of what some of these magnitudes, potential magnitudes could be. I mean, they are models, and as Steve said, they're educated guesses. I recall when we put our first paper out, we were called financial intellectuals. Well, that was a generous statement. Other people called us smarty pants mathematicians. Well, yeah, I guess you could call it that too, but you're just trying to get the best information you can and put it into an organized framework so that you're not just totally guessing and you're not just going with instinct. You've got some numbers and then you can use your best judgment whether you believe them or not. Next, please, Kat. Okay, so the 5 intervention levels that are considered are 6, which would be the baseline, which would be no intervention. So we got level 1, closed schools. You can read these. Level 2 is what Wyoming is or has been, closed schools, bars and restaurants, and ban large events. And so you can see, you can go all the way up to level 5, which is essentially shelter in place for everyone but essential workers. And so you can play around with these different intervention levels and take a look at the magnitude of impact, both in terms of potential loss of life and in terms of decreases in state income. Next, please. So here, if we take a look at this one, we've got schools closed, and this is a May 15th guideline, and they're projecting the cumulative fatalities. If we were to go to a level 1, which is moving from 2 to 1, which means opening up bars and restaurants and allowing for large events. And as you can see, they're projecting out to a potential range. That's the pink, sort of looks like a funnel being sideways. That gives you the range. And then the dotted line in the middle of that gives you the mean prediction as to what they think the cumulative fatalities would be starting now and then moving to level 1 on May 15th and what it looks like in terms of fatalities. And you can compare that to level 2, which is what we're currently on. And so you can see the fatalities are expected to go up on average. The range gets bigger, even though the bottom end of the range is about the same if we get lucky. But you get an idea of how it looks. Next, please. In terms of the impact on the money earned by the folks and businesses here in Wyoming, you can see the drop if we continue to at level 2 is roughly 330 million. And if we go to level 1, it is a loss of 315 million. So we're talking about gaining 15 million in money earned in the state for increasing the risk to for higher mortality, right? So you can decide as a policymaker whether or not that extra 15 million is worth the extra risk, right? Because it's not millions of dollars is nothing to sneeze at, but percentage-wise, it's not that big of a change. It's not like we go from 330 million down to no loss to zero loss. We still have a significant loss for all the reasons that Linda and Maddie talked about in terms of consumers and essentially either being nervous or drops in income due to unemployment. Next, please. This next one is, let's just say we opened everything up. And now you can see in terms of the predictions for cumulative fatalities, they go significantly higher now. The entire range is above where we are with level 2. So looking at your screen there on the right is level two, where our baseline. And then on the left is opening everything up. So it's essentially no more social distancing at all. So the projection in terms of fatalities is significantly higher. Next, please. The gain in terms of income now is we capture an extra $100 million in terms of higher state income for folks and businesses. So again, there's the trade-offs that economists are always talking about, you know, the two-armed economist on one hand, on the other hand. But what you've got to be thinking about is, yeah, the risk dollar balance and the risk dollar trade-offs that we face. And so, like I say, you can go to the RAND. The link is on these slides. It was on the first slide of my part here. And if you can't find it, you can always email me and I can get you the link. And this is really what Steve is doing in a little simplified way, and also making it very user-friendly so that people who have to make hard decisions, like the policymakers here in the state and the businesses and everyone else who has to decide what to do, can understand some of these trade-offs that people are facing at this aggregate level, at the state level. I think that might be my last slide, Kat. Let's check and see. Yep, I will turn it over to Dave Finoff.
Thanks, Jay. I appreciate the chance to be here and chat with many of you. There's so many names on that list. I'm not quite sure how many I know or I don't. Kat, next slide, please. I'm going to talk really about two related projects that we've been working on feverishly, if you will, over the last couple months. We had a bunch of work pre-existing COVID-19 that was really interested in how people respond to diseases and disease risk. Then this calamity takes place and we just kind of change tack and jump straight into it. And the two key policies that we are gonna, that I'm gonna talk about today of our work are namely with respect to testing and with respect to vaccine and vaccines, sorry. As an economist, all we're ever trying to do is to evaluate the pros and cons of these public policies and provide guidance in terms of what might be good ways to deploy these policies and what might be really costly ways. So the first one that we're interested in here really reflects what Steve was talking about with regards to testing. And the really neat thing about some of those findings in what Steve was talking about is that if you test and you can target who basically goes straight into quarantine, that means you can really take your foot off the social distancing, one-size-fits-all type breaks. So testing is a really key policy that that we were interested in. And so what we were interested in is, hey, listen, if you were able to have a free test, who would be the people who would take the test, quite frankly? And what we were actually worried about initially were these super spreaders, like basically the college students, right? Flying around all over and mixing with all these different sorts of people, and people are really worried about their behavior. But what we found is that college level type, or these super spreader types, be they a female or a male, are really willing to take the test. So the people we were most worried about in terms of spreading, they'll take that test. Unfortunately, the people most at risk, so the elderly and the high risk groups, they are, and there's a difference between females and males, of course, they're the ones least willing to take the test. So while this testing is going to be, I think, a really key next step for us as this state to move forward, you got to realize that some of the people you're most worried about are probably going to be the least likely to take that test. And we've got to come up with ways of dealing with this behavioral trait. Next slide, please, Kat. The next question that we were really interested in is, hey, we're all waiting on this silver bullet from a vaccine, and is this gonna help us out of this hole, basically? So the purpose of vaccines, right, is, as most of you know, and if you're thinking about models like what Steve had, is that they immediately are able, if you're able to deploy a vaccine, a bunch of people are willing to take it, it's very effective. You can essentially move your population from being all at risk to this concept of herd immunity, where if you can essentially make enough of your population immune, the disease will burn out on its own. So like we've seen with all these other diseases in history, if you can do this, it really is incredible. Now, the interesting thing that's become more and more apparent in society, especially in the US society recently, is that a lot of people are not willing to take these vaccines. And if you have a vaccine that people aren't willing to take and it's not 100% effective, then you have a potential problem in trying to get to this concept of herd immunity. So we deployed a survey. The last survey was national sample, and so is this one. I should have said that. But what we find here when we ask them on whether or not they're going to be willing to be vaccinated, we found that about 20% said they would decline this vaccine. And we deployed this survey right in the heat of this pandemic. So even with this terrifying thing sweeping across the world, 20% of people still said, I'm not going to take it. And we found that they weren't going to take it because some people are just hesitant to taking any vaccines. There's a lot of distrust in terms of vaccine safety, and the fact that it's new is also an issue. One really interesting component for policy that we found in this, if there are conflicting messages from different institutions in society. So for example, if the White House says the risk is lower than what the CDC says, then people are going to be even less willing to take a vaccine. And that could really, especially if you're waiting on it as a silver bullet, lead you into some real trouble. We found it pretty interesting. The graph on the right is basically, we asked people, for the people who said I don't want to take this thing, why they said they didn't want to take it, and a lot of it is to do with it's brand new. I don't know what the side effects are, for example, or I don't even think it's going to protect me. What was really interesting to me is that we saw that a bunch of people, of those people, 61% said COVID-19 isn't severe enough for them to be willing to take it. So it's a real issue. Now, where it starts getting to be problematic in terms of policy making is whether or not you can hit this concept of herd immunity. So next slide, please, Kat. And what we were interested in there is kind of going back to merging this information on how people will respond in the face of this in the face of this pandemic to the opportunity of a vaccine and your ability of deploying that vaccine and getting something useful from it. Next slide, please, Kat. Well, so what we did here is we basically just kind of merged again some basic economics on how people make their decisions and some epidemiological models. And what the ability of a vaccine to get us to this concept of herd immunity boils down to relying upon 4 key parameters. Whether or not people avoid the vaccine, I'm calling this H, it's the horizontal axis on this graph. Whether or not your vaccine is effective, I'm calling this epsilon, it's the vertical axis. Of course, how quickly the virus spreads, which is going to be given to us by this R0 number. You guys are probably sick of this thing, but it's basically telling us how quickly the virus spreads throughout a population. But it also depends, of course, upon how many of your people have actually currently, your population have currently, they've been through the virus, they've been infected, and they're now immune. So we generated some contours here for each of these kind of parameter collections. So if you come down to the second line down from the top left, this is a contour at which, in this parameter space, that if you can be above and to the left of this, you're going to be able to eradicate that disease by just this vaccination program. So it's associated with an R0 of 2.4. We said that very few people are actually recovered. And we have this 20% people being hesitant about the disease and a 60% effectiveness. So that star that I've got on there, which is very ugly star, kind of shows us that even in a best case scenario here, and we deploy a vaccine that's 60% effective, 20% of the people pull themselves, if you will, out of it, you're not going to be able to immediately hit herd immunity. And if you're not able to hit herd immunity you're not able to vaccinate enough people, you're still going to get basically a second wave of infections. Next slide, please, Kat. So we put this into this simple model like what Steve had before, whereas what I'm going to show you here on this horizontal axis is the percent of your population that's susceptible. The vertical axis is the percent of your population that's infected. And essentially, this is how mathematicians and epidemiologists kind of look at the progression of an epidemic. We would start over here on the right-hand side if you didn't have a vaccine, and you'd basically see the epidemic, which is the top red line. The infections would increase up to a peak, after which, at that peak, they decline. That peak basically is the level that we've got to hit for herd immunity. So it's a really important kind of planning point. If you can vaccinate everybody and hit that where the dashed line is, herd immunity kicks in, and you've minimized your problem. Unfortunately, because people pull themselves out of getting a vaccine and vaccines aren't 100% effective, you can't make it all the way, which is kind of like this little VE thing. It just gets us part of the way there. You then still get a second kind of a mini epidemic, if you will. But it's still a lot less than what you'd get if you do nothing. So what we did is into our model, we basically found that if you had a vaccine and you deployed it and you want to immediately hit herd immunity, you'd have to vaccinate about 58% of the population in Wyoming, which is 334,000 people, of course. Our best shot of getting there, given the hesitancy and this ineffectiveness of vaccines, is that we're effectively going to vaccinate 160,000 people, which means we're going to see in the end about almost 6,000 excess or 6,000 infections, even with the vaccine, which is tremendously smaller than if you didn't have the vaccine, but there's still going to be some potential consequences there. However, that's all taken if we ignore, or if we don't think that, if we look at the current data and we say that that data is actually accurate. Because the current data, we have 510 confirmed cases in Wyoming and 300 or so recovered. But for a lot of the data is finding in the rest of the world is that that number of infections is about 4 times larger than that. And so the numbers of recovered are bigger than the currently gathered numbers of recovered. And what we find here is that if you have 10% of your population that are actually recovered, so all those asymptomatic people are actually recovered, then if you deployed this vaccine, you could hit herd immunity and burn the thing out immediately. Next slide, please. And we are done.
Yeah. All right, thank you all for that great insight. And we've received a number of questions here that I'd like to just share with the group, and whoever feels most comfortable tackling it, please jump in here. One of the first questions that we have here is, what does the group think, which sectors of the economy are likely to recover the fastest and which are the slowest? And do you want to take a shot at that one? Dave, you want to? Or
I can take a shot at it.
okay.
So which, that is an excellent question. Now we see more volatility in goods that we consume on a less frequent basis. So in that sense, we see larger drops, but we also see faster recoveries of those sectors that, so that would be, well, anything that are durable goods and also entail services. In this case, we haven't seen the same drop in sort of a more necessary consumption, and as Maddie also said, we've seen increases in that so far in Wyoming. So where we see the biggest hits, that is also where we're likely going to see the steepest recoveries. But it all depends on to what extent we're opening up and to what extent people feel safe. So anywhere too where you have a lot of contacts, as long as the virus is out there, and as long as people are nervous, they're not going to take advantage of those consumption opportunities, even if they're there.
Great.
The only thing I would add to what Linda said would be Wyoming seems to be where particularly vulnerable, given the energy recession that's going to be that is occurring simultaneous to the social distancing problems here, and that is just seems like a fairly long road, given the current inventories on ships outside, just waiting for people to start demanding again, and that poor industry is it's going to have a double whammy likely. And Rob Godby's been writing and talking about a lot of related work like this recently. So if he's on here, he could always speak up too.
And that's actually a great lead into one of the next questions we received here. And one of our participants is asking just that, as we think about the mix of our state's economy, has that mix made things better or worse for us as we think about that recovery period?
Well, this is Jay. It's hard to speculate about that. I mean, the downside, of course, is with energy prices doing what they're doing, it's harder for the state to do its business, and it's harder for all the communities that depend on the energy sector outside of the virus. Now, the fact that we've done a fairly good job of social distancing here in Wyoming, either de facto or because people take it seriously. It's almost an example of the Swedish model here in terms of the biggest difference being that schools were still open K through 6, at least in Sweden, but people took it responsibly. So some of the drops have not been as big as the national average. And so then the question is whether we'll rebound quicker and people will take it seriously. I know business like here in Laramie, Altitudes, they're reopening now the restaurant, and they have spaced out their tables so that everybody has the distance they want. But at the same time, they've also opened up that space to for other businesses to advertise, right, to promote all the other businesses in town. And so Altitudes is trying to take a lemon and make lemonade out of it by sharing their extra space they created as a way to promote more cooperation and more business within the state. And as long as we can have that kind of creative thinking at all levels, I think if we do this smart, we take our time and do it smart, we'll bounce back. But it will take paying attention, and it will take thinking outside ways we typically don't think.
Thanks, Jay. And another question here, and again, sticking with the mineral extractive industries, and specifically as we think about oil, have we done any kind of an analysis on how quickly or how high the price recovery needs to be to get the economy of Wyoming back to quote unquote normal?
If anyone has, this is Jay again, if anyone has, it's Rob Godby. And I think Rob has been working on that. So I'm not sure if he's been in one of these COB COVID meetings yet, but if he hasn't, he should be invited to do one of these, because he's really been looking at this interface between energy and the pandemic.
And that's a great point, Jay. And our intention here for our next information session will be to feature our Center for Business Economic Analysis. And I believe we're going to do a deeper dive into some of those economic impacts in the future of Wyoming here in a couple of weeks. And so we're going to do one more question here before we wrap up. And so a lot of talk in the media about what the recovery is going to look like. Is it going to be a V, a check mark, a U, or something else? What's the opinion of the group on what that economic recovery looks like?
Well, it all depends on what the virus is going to do. So, and if there is a second wave of the virus, then we will have a V-shaped recovery. And because then most likely we're going to self-protect again, whether or not it's mandated by governments or if it's self-selected by people themselves. As we talked about during the presentation today, this is not just the lockdown orders or the mandated orders, but people self-protect, and that means that we're not consuming the way that we otherwise would have. So that's going to drive us into a V-shaped recession. So it really is dependent on the extent to which we can control the virus. At this point, given that we don't have a vaccine in sight yet, we don't have an effective treatment. If we have an effective treatment, that's going to change everything. If a vaccine is not likely to occur until, most optimistically, perhaps in a year. So that is perhaps an unsatisfactory answer, but there's a lot of uncertainty surrounding the recovery at this point.
This is Jay. Oh, sorry, I interrupted. Go ahead.
Yeah, no, I just wanted to say that the more optimistic scenarios, we, assume that we have the virus under control and we go back to fairly normal in the fall. And, as time goes by here, that looks more and more unlikely.
I think that's the power of the modeling exercise that Steve laid out, is we can take those scenarios and we can run as many different scenarios as you want, V-shaped, U-shaped, L-shaped, and we can get an idea of the range of costs and benefits for these different recovery patterns. And I think once you get an idea of the range, you can see if we're talking between minus infinity and plus infinity, or we're talking between 200 million and 300 million. That degree of understanding on how big the impact is going to be really matters. So to reduce some of the variance and reduce some of the noise around what signals we actually are seeing, these models can help do that. And that's something that we've played around with in our work, specifying these different potential recovery patterns, because, economists are like weather people. I mean, we're not great at predicting the future. Things change. And so we need to be able to lay out the range and be able to give our best advice as to where we think we're going to fall in that range, but that doesn't mean we're going to perfectly predict it. So we're willing to work with people to fine tune that, our understanding on that on a real-time basis. So that's what these models are good for, helping us frame the question in a way to help you make decisions.
I would just add one more thing to that, just kind of reinforce what both Linda and Jay said, that I think a lot does depend on what happens next. We've already started relaxing social distancing, and, if sort of half of us are eager to get back out, maybe half of us are reluctant. I would anticipate, some more increase, not a full rebound of those graphs that Linda showed at the beginning, but maybe a half rebound. If that happens, that's going to constitute an experiment that we'll see the outcome of in a matter of weeks. It'll take some number of weeks to see an uptick in infections, if that's in the cards. Another unknown that I didn't talk about earlier in the modeling is, but was mentioned, is this asymptomatic fraction. That's another big uncertainty. How many people have gotten the virus and didn't even know it, or had mild enough symptoms that they kind of just blew it off? But if enough people have contracted the virus and are now immune, then sort of the uptick might be small. That's the optimistic scenario. So if that happens after this sort of partial experiment in the coming month or so, then I think that would bolster people's confidence. So I would expect to see the trends continue after that. If there is an uptick, then things could sort of fall back to where we are now. So that's my conjecture.
Well, and I would only add to that it's as we start taking our foot off the social distancing throttle, if you will, the role of testing and what Steve's results that he talked about really, I think, bring home is the fact that there's got to be a widespread testing program that is repeated. And if I was running a business and my employees were my most important thing, I would want to test them immediately and keep testing them. And if they get sick, send them home, 2 weeks off, sick leave, come back and get back at it. I think that the role of testing here can really blunt the blow, because with this with this thing, you just don't know if, like Steve said, you just not quite sure if you got it or you're not. And it's the only way to really know when to put yourself in quarantine. But it's a powerful tool.
One last quick thing on testing I also didn't mention is other type of testing that would be very useful to figure out how many asymptomatic cases there are is testing for antibodies. And so that's the kind of thing that could be done earlier in one big shot. If we could figure out what fraction of cases are asymptomatic, that would help us get a better sense of what the sort of risk of a second wave are.
Okay, I think we've exceeded our hour block, but again, great insights, and we really thank everyone online today for participating in today's College of Business information session. And we appreciate the efforts of our faculty to bring these great insights. As I referenced a little while ago, you'll see more from our economists as we feature the Center for Business and Economic Analysis in a couple of weeks here, and their work to support the economic growth and diversification of our state's economy. As a reminder, you'll also find a recording of today's event on our COVID informational website. And again, that's the site where you went to register for today's event. We appreciate everyone's partnership, and we look forward to having this and additional informational sessions here, both in the next couple of weeks and in the months to come. Have a great rest of the week and continue to stay safe. Thank you.